Hi, it's James from DecadentDecaf.com, the UK's leading decaffeinated coffee brand. Today, we're going to ask the question: can I drink regular or decaffeinated coffee if I have atrial fibrillation? First of all, briefly, what is atrial fibrillation? Atrial fibrillation, or AFib for short, is a type of irregular heart rhythm that can lead to blood clots. It is the most common form of arrhythmia, which means it occurs more often than other types of irregular heart rhythm. It is a type of irregular heartbeat that causes the atria, or upper chambers of the heart, to quiver and misfire. In this condition, blood does not flow smoothly from one side of the heart to another. Instead, it pools in one area and can cause blood clots to form in other areas of your body like your lungs and brain. The symptoms are similar to those experienced by people with other types of irregular heartbeats such as atrial flutter or paroxysmal supraventricular tachycardia, PSVT. People who experience these symptoms should seek medical attention right away, as they may need treatment for their condition. So, can I drink regular caffeinated coffee if I have atrial fibrillation? For a long time, patients who suffer serious cardiac problems have been advised not to take caffeine. However, now scientists are rethinking their decisions. Indeed, a study entitled Caffeine and Arrhythmia, published in 2005 in the American Journal of Clinical Nutrition, suggested that only people with severe atrial fibrillation should cut down their caffeine intake, and that those with less acute AFib could still intake some caffeine during the day without any worry of AFib-related issues. However, it is still better to take precautions, as caffeine has been found to increase the risk of atrial fibrillation in people with underlying cardiac disease. This is because caffeine increases blood pressure and heart rate, which can lead to an irregular heartbeat. Caffeine is known to have several effects on the heart. These include increasing blood pressure, increasing cardiac output, and decreasing oxygen consumption. This is because caffeine is a stimulant drug that acts as a central nervous system (CNS) stimulant. Caffeine stimulates the CNS, which instantly increases heart rate, blood pressure, respiration rate, and muscle contractions. Can I drink decaffeinated coffee if I have atrial fibrillation? There does not appear that any research has been conducted to conclude if drinking decaffeinated coffee has any effect, positive or negative, on atrial fibrillation. But, given that decaffeinated coffee only contains minute quantities of caffeine, it would be logical to assume that decaffeinated coffee is safe for atrial fibrillation. Here at DecadentDecaf.com, we recommend the Swiss water process of decaffeination, which uses water, no chemicals, to decaffeinate the coffee beans and is 99.9% caffeine-free. To find out more, please visit www.decadentdecaf.com or check out our YouTube channel for more videos on decaf, caffeine and coffee topics.